You're listening to the Sports Therapy Association podcast, putting evidence back into soft tissue therapy.
Hey people, how are you doing? It's the 6th of September 2022 and you are listening to the Sports Therapy Association podcast. How are you? This is Matt Phillips here, in case you're just listening to the voice, creator of OneChatLive.com. And if you are listening to the podcast, and thanks very much, it does go out live, which is why you're going to hear a reference to lots of things happening on the screen tonight. If you do want to join us live, then all you got to do is come along to YouTube, the Sports Therapy Association YouTube channel, at 8 o'clock on a Tuesday. We've done that for the last 115 weeks without fail, pretty much. And now this is episode 116. And to those of you who do join us live, then if you want to ask a question direct to the guest, then you can do so. And I can bring your message up onto the screen and we get to see your YouTube logo. So it's a great way of networking, hanging out with fellow therapists, etc., etc. I'm just going to wait to see if a few people do come to the live lounge now, or I don't like starting until I do see at least a few hellos. What it is tonight, because it's the first of the month, as I've kind of said on social media, what we're doing the first of every month, we're having a Have Your Say episode. And that is where basically we have a chance for you guys to join us live or send in emails, and we talk about the last month's episode. So last month was all about focus on the knee, so we might have a little mention of that tonight and answer any questions you might have, if you enjoyed it, if you wish we'd had something else, if you liked what you liked of it, what you didn't like so much. And we're also going to talk tonight, it's a special session for Therapy Expo, which is happening in Birmingham, which I'm sure a lot of you know about. But if you don't, then it's a great convention, which I think is on year. Oh, you think I would have had that written down? I'm going to take a gamble and say it's the. Hold your fingers up, Liam. How many years is it? 7, 8, 10. Of course it is. It's the 10th time it's been on, and it's in Birmingham. It's moved around the country, but now it's in Birmingham for the last 8, I think. And it's, for us in particular, for the STA, it's a great time to meet up, because we have our own dedicated STA Theatre and event stand, and it's a real great networking event. You don't have to hang out just with us, obviously. We recommend you do. It's with the cool cats, but it's a huge, massive event in the NEC, and it's a great, I mean, it's particularly good, I think, these days, because face-to-face is kind of becoming a thing of the past a little bit, isn't it? And it reminds you all, that's what we found last year, reminds you all the value of actually being able to see someone in the flesh, whether it's each other, fellow therapists, or whether it's your favorite speakers and educators, because it's just great. It's something we don't want to lose. So we're going to be talking, we've got the good fortune of having Liam Richardson in the house, who's the content manager for Therapy Expo. So we're really looking forward to listening to Liam about how he found last year and what it's going to be like this year. We're also going to have a little chat later on about topical things. So I think I put into the advertisement, we're going to talk about acupuncture and dry needling, because it's been very much in the news recently, with certain elite athletes saying that they revealing that they had their lung punctured and that they were retiring early because of an ill-placed needle, and that's cast a bit of a shadow on what was already a profession, I could say, with a little bit of a shadow. So we'll be talking about that anyway, as well, and any other news to do with sports therapy and sports massage therapy. That's it. Right, I'm happy now. People are coming into the house, so welcome those of you who've joined us live. Thanks so much. Thanks for giving up your time. I'm just going to bring a few messages up on the screen. You can't see these listening to the podcast, but Becky Carroll is in the house. Hey Becky, how are you doing? Thanks for joining. Lindsay Penn is here as well. Hi Lindsay. Ivan Ward says, hello Matt, thank you very much. Hello Ivan, how are you? Who else have got? Glenn Murphy, hiya, how are you all doing? Claire Walker is here. Good, they're all flocking in now. Hi everyone, looking forward to Therapy Expo, says Catherine Reimer. And Catherine and Becky has said to Catherine Reimer, booking the hotel tonight. It was so nice. For example, last year was great because it was post-COVID, wasn't it? But it was so nice meeting you, including Becky and Catherine and other people, and Glenn, because it's so nice to meet people face to face these days. I can't say it many times. But anyway, so there we go. So that's what's in store for you tonight. Just to remind you, before I do bring our guests up, last month was focus on the knee. I've done 2 months now, body parts, to kind of keep people knowing what's coming up. So it was all about the knee. We had the fantastic Angela Jackson talking about the adolescent knee. These are all available on YouTube if you want to watch the video, or you can go to thesta.co.uk, where we've got the video up there as well as on the show notes. Or if you prefer listening, then you can download the podcast on all popular podcast apps, including Spotify. So we had, like I say, the adolescent knee with Angela Jackson, and details of the courses she provides. totally recommended. Obviously, it's my bias, but I recommend you check them out. It might not be the one that suits your career, but it's definitely worth checking out. We followed that 2 weeks ago with the equally fantastic Claire Robertson, known on social media as Claire Patella. That was focusing on patellofemoral pain and fat pad syndrome. Really great. I mean, such a good educator, really makes the complex simple. That was something that was repeatedly said both during the show and in feedback. So a great episode for you to check out as well, and also details of Claire's courses, which you might be interested in. And then last week was fantastic. I'm glad people enjoyed it, and thank you for the emails you sent me. If you want to comment on anything, it's matt@thesta.co.uk. That was with Jonathan Bell, who's a surgeon on knees, somebody who we think is just sitting in some big lounge for gentlemen somewhere smoking a pipe and not talking to anyone else. Couldn't be further from the truth. And Jonathan Bell showed that as a surgeon, he is equally feels equally responsible for making sure that unnecessary surgery doesn't happen. That takes a multidisciplinary approach, so people are talking to each other. And it's a great episode. We focus particularly on arthroscopy and how the view on that has changed with relation to osteoarthritis and meniscal tears. And again, it's a fantastic episode, really, again, making the complex sound simple, which is what all my guests seem to have a knack of doing. It's funny that. So there we go. So they're all there. If you want to watch them, check them out. Like I say, it's free CPD. I mean, it's great. Please don't ask me what CPD I should do until you've listened to 150 episodes of the Sports Therapy Association podcast. Simple as that. Right, and tonight is Have Your Say. So I've left them down there. We've got a few people coming up. We'll have people popping in. People will be coming and going. But the most important thing is, if you've joined us live in particular, fire away with questions. Jump in there. Our guests are welcome to have a look at the chat going on and just direct our attention to anything that gets answered, which is relevant. So do please make this Have Your Say. And if you listen to podcasts and it creates any questions, and feel free again to email matt@thesta.co.uk, and I'll make sure they are answered either live or personally or directed towards the person who can most help you. Right, that's it for the now. Let me get rid of that artwork. Let's hide that, and we shall bring up who have we got with us tonight. Let's just get rid of Becky's comment for the moment. I'm sure there'll be more there coming up. So in no particular order, we got Gary Benson, founder of the STA, joining us. We got Liam Richardson, content manager for Therapy Expo, and also down here waiting patiently, we got the wonderful Dr. Fiona Higgs, co-host of the Women in Sports Therapy podcast. Bringing Fiona up now. There we go. Hey people, how you doing?
Good evening.
Boy, I just thought then suddenly there was no volume for any of you. That was why. I don't want to be massive. That's better. I don't want to be huge, taking over the screen. Right. Thanks for joining us all. Particularly, no, I shouldn't say. I can say particularly you, Liam. Thank you, everybody, but particularly you, Liam, because I know you're busy.
Thank you very much. Thanks for having me.
It's great to see you again. We were just saying off air that it must be about a year, because Therapy Expo was about a year ago, or just 4 years ago. So time has flown, hasn't it?
Yeah.
And Fiona, how are you? Busy day?
Oh, busy, yeah. Not too bad. Someone actually, I went to Halfords to get some side lights replaced on my car, and someone drove into the side of my car, so it was eventful.
Oh my God. Oh, I'm sorry about that.
It wasn't too bad.
Oh, it's probably somebody who's busted or broken their little toes or big toes and shouldn't be driving.
Oh, yeah.
How are you going? How's your toes?
Yeah, I'm fine. Thank you, Matt. Thanks for bringing that up.
Yeah, in case you haven't heard or seen it on BBC, then Gary has manages to break two of his toes. So the cough seems better, but you're in agony, I guess, in the lower department now. I'm sorry to hear that, Gary.
Thank you for your sympathy, Matt.
Oh, hold on, I've got a can of man up here. No, I'll leave that there. Anyway, so we are here. Let's start off then. It's Therapy Expo. We were all at Therapy Expo, obviously, last year.
Yeah.
It was fantastic to get a chance to meet you there, Fiona. It was lovely. First time we've met. I love a woman that I look up to. And it was a great event, wasn't it? Liam, did it go? It was your first year organising it, was, or being content manager for it?
It was, yeah. So when I was on this last year, it was a little bit nervous, to be honest, because I had no idea what to expect. And obviously, I think we talked. I mean, you mentioned it as well. It was the first year after the pandemic, and is face-to-face dead, or that was the sort of question, wasn't it? And thankfully, it went really well. A lot better than I expected. Good thing I'm still here. I'm still in a job, so it can't have hopefully gone too badly. And yeah, our aim now is, now that we've had a year of being able to, see exactly what was happening, what worked, what maybe didn't work, draw up more plans for this year and look to build on it, really. So yeah, that's been what's been going on for the last sort of 12 months. since the last time.
Fantastic, very exciting. And for those of you listening to the podcast, if you're not aware of it, just to repeat, it's November the 23rd, which is the Wednesday, and November the 24th, the Thursday, at the Birmingham NEC. Gary, went well last year, didn't it?
Yeah, it was really well, and as we mentioned off air, it's well, you mentioned it earlier, 10th year we went to 2 at Manchester, then we've been at the NEC every year so far, and Liam and I spoke before last year's event, and I said that I was really worried about the sort of prevalence of online CPD provision at the moment, and wasn't really sure whether we'd get those numbers, and I don't know what the official numbers were, but yeah, we were busy both days. There was a feeling of everybody wanted to get out there, and Therapy Expo had some measures in place where you had to show your COVID passport, and I started off in a mask, but everybody was respectful of social distancing, and yeah, it was a really good event. Really enjoyed it.
Yeah, Fiona, was it your first time up there? I can't remember.
I think I'd been to one before that, I have a feeling, but I've been to quite a few different events at the NEC, and they do sort of start to become quite difficult because you meet the same people. But I'm sure I've been to a Therapy Expo prior to COVID. I'm certain of it. But yeah, I may be wrong now.
Last year there was a buzz, wasn't it? Because it was so nice to meet people who we'd talked to for 78 weeks or something, or 58 weeks, whatever it was, and it was lovely to meet you and everybody. I'm wondering, Liam, what do you think? Does that make it a bit tricky this year to keep it as dynamic as it was last year, now that people have had a chance to see each other face to face? Or do you think there's still going to be a little buzz of, oh wow, a live event?
From what I've seen, there is still. I mean, last year I think it was twofold. You had, on the one hand, you had people that were quite nervous, and then you had the people that were sort of itching to get out there because they were, fed up of just staring at the same 4 walls for the last year. So I think, from the people I talk to, everyone seems as excited as last year in terms of how we're doing, in terms of registrations, in terms of speakers, etc. We've got more at this stage than we had the previous year. So yeah, I think last year, like we said, that was that big question of if face-to-face is dead or not. And I think actually people found the real value in it. And I think what we've seen across the board at Closer Still, and because obviously we do events not just in this area but across the whole of healthcare, is that people are more selective. They're probably a lot more picky about what they do go to, but they do want to make sure they go to at least 1 or 2 things in a year, particularly where CPD is involved.
Mm-hmm. And is there anything that you think people who are listening, for example, the podcast, should know if they're umming and ahhing? What have you got in store? I mean, I think it's a very healthy looking program. There's such a wonderful variety of speakers. I think that stands out always. You get an amazing choice. Is there anything else in particular you'd like to kind of mention?
I think for when I started, some of the feedback I had, I know from talking to people like Gary as well, was people wanted it to be dynamic, and there were obviously certain speakers they wanted to hear from on a regular basis, but they also wanted lots of new speakers as well, and not just to hear from the sort of same old people. So one of the main things we did this year, and Gary is part of the group, is to have an advisory board, people from across the industry, lots of different voices. So there's a whole range of people that are on that group from different backgrounds as well, just to give us some advice on interesting speakers that we might not have ever heard from before or had on the program. And so we've met several times over the year, all virtually, of course, just to try and put the program together. So yeah, Gary has been involved in that and come up with some good suggestions and helped me out a bit as well. So I think that's the big change, that we're trying to be better connected than we were previously. In terms of a few other changes, we've got some business advice clinics that we're running. So we did that on a small scale last year, but we're sort of ramping that up. We've got a hands-on hub as well that we're working on with people like Anna Maria Mazzieri. So she's doing some work on that. I think she's speaking in the Therapy Update Theatre with you guys as well, potentially, I think.
Yeah, definitely.
Right. So, and obviously you guys have got your, the properly branded Therapy Update Theatre this year, which is the STA's. So yeah, there's a few new things we've got going on. So yeah, it's coming together pretty well.
It all sounds great on paper. Gary, you happy with what looks to be a great event this year?
I'm hoping he's going to say yes. Yeah.
Well,
no. No. I mean, from experience, that, you know, as Liam mentioned, we've been part of an advisory group where we've met remotely, and there's probably about 10 or 12 of us have been discussing content, discussing direction, education, not just about, you know, who's a good speaker. It's about, you know, what does the industry want? And I think, you know, in all of the 10 years that I've been going, this year is the first time that it's happened that we have been consulted with as to about, you know, where the content should go. So I've really enjoyed it. I've met some new people. You know, it's all about networking, and I think it's going to go from strength to strength. And you know, now there's another part of the I'm sure this is public knowledge, Liam, about the NSK section of it, which, you know, it's going to be another 300 or 400 health professionals in the sort of halls as well. So again, it's all about networking. So I'm really looking forward to it.
Fantastic.
Yeah.
Fiona, have you had a chance to look for the programme, or anything in particular, as well as obviously you're opening the show for the STA Theatre on the Wednesday morning? I'm really excited. It was your suggestion, wasn't it, doing I don't know if you know about it, Liam, you might do. I've talked to Shane about it, but it was Fiona who kind of said, rather than a presentation, how about if we do kind of like one of those round table chats, a bit like they've done on TV with directors and actors, and it's going to be talking about women in sports therapy. But I thought it was a beautiful idea. And Fiona, I can confirm now, I'm not sure if I told you before, but we have got 4 headphones, 4 speakers, and it's going to be you and Debs and 2 other people. One will be Anna Maria. The other person I'm still sorting out, but nearly close to saying who it is. But yeah, that's going to be really exciting. I'm glad you mentioned that. I think it'd be quite a good way of getting the message across, won't it?
Yeah, it's what I think we've found through the WIST podcast is that having more voices, you know, not an overcrowded kind of room, but having a few people kind of bounce ideas and conversation off really helps add a dynamic. Yeah, I love it too, Becky. Yeah, it is a good idea.
Great idea.
And I think that we can bring the audience, you know, the people who are showing up, the opportunity to add to that conversation. It's very one-sided, you know, in a podcast kind of scenario. And we know that there are some fantastic speakers out there, you know. I mean, I can't wait. I'm trying to remember, I met Anna Maria last year, but we haven't really had a lot of time to talk. You know, I've just had a little communication with her, and it looks like I might be over at her kind of stage for a section in the afternoon as well. So just, I mean, if anybody out there has got a theme that they want to hear me present on, I'll be happy to hear ideas, because I'm just trying to formulate that subject. But yeah, like, it's really good to get the input from obviously you guys out there who are going to be showing up and trying to get your money's worth.
I think you're going to set a precedent. I think you wait. I mean, Liam's here now, so Liam can hear it. But I think next year, I wouldn't be surprised if there's a few more little round tables that people can sit in a big theatre. It obviously all started at Run Chat Live International Running Conference, where I had all 10 speakers just doing a chat, a question and answer on the stage, and people, and that was amazing. Just hearing these people talk to each other, and it's like, yeah, a lovely way of doing it. But yeah, really excited about that, Fiona. It's going to be great stuff. So price-wise, Liam, still competitive? Is it difficult to keep the price as low as it is?
I think there's always, it's always tricky, especially, you know, in the last couple of months. I think, you know, all businesses, you know, are going to start, you know, depending on what happens in the next week or so. We've got a new prime minister, and you know, hopefully going to be some help with things like energy bills. But yeah, I mean, places like the NEC, there aren't. It's strange because you wouldn't think it, but there's very few places overall in the country, you could probably name them on one hand, that are big enough to actually have that many thousand people in a venue. So they are, you know, it's sort of like a monopoly in a way. I mean, I probably shouldn't say that, but so it is tricky. But yeah, this year it's £109 until the 30th of September. But I think I'm right in saying that the STA members do get a 20% discount as well. So
yeah, what we'll have to do now, Liam, because this goes out to the wider industry, we'll have to change that code. Because everybody will become an STA member now. But yeah,
well, I'll probably get shot for that in the morning, then, won't I? Hopefully no one is watching from my employers.
Yeah, there is a discount code which Jake put in the members group, and it is on our members portal as well. But yeah, we'll gloss over what it is. But yeah, we do get a favourable price.
Join the STA.
There you go.
Well, there's no need to join now, Liam.
No need.
So I was going to say there's no need to join.
Yeah.
No, I think I appreciate that a lot of the time, especially in our industry, it's tricky where to spend the money, but I think it's more where to spend the money rather than not having the money. I think therapists understand that to keep themselves up to date, they're going to have to spend some money. It's one of the expenses of having a business. And when you break it down to maybe 3, 4, depending what you charge, in some cases maybe 2, depending what part of the country you're in, it's pretty much a no-brainer when you've got 2 days. I'm not just saying this because you're on the show, but the amount of content you can pick and choose from our network, and the quality of the event, and also it's in Birmingham, which is a pretty nice central place to get to. For 100 quid,
Birmingham's a great place.
Birmingham's a great place. Yeah, no, very exciting. Okay, yeah, and like you mentioned, Liam, we have got the STA Theatre, so I'll be giving details of the speakers out for that later on. I've already said Fiona and Debs and guests will be opening that up. I'll be putting that out on social media as well later on. So yeah, anything else about Therapy Expo, Gary, you want to mention or talk about, or questions for our Liam here?
Yeah, I think one thing that I want to mention is that Fiona mentioned about the roundtable panel discussions. There are some of those taking place at Therapy Expo. That was one of the things that was raised in the advisory board. But for me, and we discussed this last year, not only does it give you the opportunity to go and listen to people whose opinions and biases match your own, I encourage people to go and listen to people and have their own biases challenged. Listen to people who you wouldn't normally listen to. Listen to what they're saying, reflect on it. They might have a nugget of information in there, and you can't do that at any other place other than Therapy Expo, where you've got a lot of MSK content, you've got a lot of physio content, a lot of sports therapy, a lot of soft tissue, and we are collaborating with Anna Maria on the sort of soft tissue side as well, and I'll be speaking along with Anna Maria there. So yeah, I'm really looking forward to it. But yeah, challenge yourselves, everybody.
That's a really great point. Before I will bring up your question soon, Lindsay, but yeah, it's so true, and it reminds me, the event reminds me of your ethos, Gary, that you've kind of fed down to the STA. People ask you sometimes, why are you advertising this course, when I've heard from somebody from the STA that this might not be that recommended, and you've always come back with, we give you the choice. We're not telling you what to go to. It's about giving choice and stuff. But Liam, how do you go about? Do you purposely try and make sure that there's kind of inclusivity for all different types of healthcare? And do you have any guidelines where you say, I'm sorry, guys, but no way, we're not letting you step through the door? It's just too out there.
I think the key is just trying to, obviously a lot of people speak on podcasts and have done online stuff, so you can sort of hear people speak. I mean, one of the key things is, what are they like as speakers and as communicators? Because that's, obviously key. And it's getting recommendations. So that's where the advisory board have obviously come in, people they'd recommend. And then it's just having a chat with all the speakers and as many of them as possible, just to see, what they're like, what they're about, and taking it from there, really. So I think for me, as I've I said this last year as well, I'm not an expert, and I'm not by background part of this industry, so I'm very reliant on just talking to as many people as I possibly can, and just really sort of testing out what's going on, looking at the feedback, and just trying to make it as well-rounded and as inclusive as possible, really. I guess the big thing from last year, and this is what Gary and I and others have talked about, is I think people want it to be obviously as practical as possible, so we're trying to make sure that that's there in a lot of the sessions and with the hands-on hub, and also in terms of we try to make sure there's a really clear takeaway from each session as well. And I think also just on top of that, it's just sort of trying to make sure that we're covering all the bases, really. We're just making sure that there's plenty of representation, and we've got lots of different speakers from different backgrounds, and people that maybe aren't always on conference programs, new people that we've never had before or don't often appear on lots of things. So I think we've got a few gems, really, and some really good, interesting speakers. that people like Gary and others have helped us put together.
So exciting. Lindsay here, Lindsay Penn has asked, and it's a great question to fit in now. Lindsay Penn, I'm just bringing this up on the screen. And Lindsay Penn says, do tickets have to be pre-booked, or can we purchase on the gate?
You can get them on the day. However, I definitely recommend price does change, so there is an on-the-day price, so you get it much cheaper by pre-booking, and there is a deadline on the 30th of September. So, and it's £109 before the 30th of September. I can't remember what it goes up to from the 1st of October, but it is a little bit more, so it's definitely worth pre-booking.
Great question, very important. And I'm just checking because I get a bit confused. I remember once upon a time, I don't think it happens anymore, that you had to also select which presentations you wanted to go and see to make sure you get a place, but now it's just queue. Don't do that.
You should be. Yeah, it should be actually fine if there are any choice on the day as well. But we do make slides and audio available usually I think it's 2 to 3 weeks afterwards. So if there's anything, if you've got a difficult decision to make, either theatre A, theatre C, at the same time, pick the one you want, and you will still be able to obviously access the slides and everything afterwards, if possible, where people have given us permission, and most people obviously do.
Brilliant. People in the house, I know quite a few people who joined us live. You were there last year, so if you've got any feedback or questions for Liam, just make sure you type them down there. I didn't get a feedback last year that anyone was seriously missing out on something, because there was always something around the corner big, and like you say, often, sometimes it's nicer sitting down with someone who's seen another presentation, having a coffee and a chat with them, because you're hearing about it and you're getting someone's impression about it. So
I think that's the benefit of the event overall, isn't it? You can, there's all the learning, but sometimes the best bit is having the drink at the end of the day or whatever as well, especially after the pandemic. You haven't seen anyone for 2 years. I think people loved that last time. Still obviously will this year as well.
Liam, one of the things that came out of the advisory group discussions was about the, if you like, the perceived level of some of the talks, and let's hypothesize you've got somebody who's entering the industry as a level 3 sports massage therapist going along to a session, and the take-home point might be totally missed because the whole of the presentation has been above their sort of pay grade. What have you done to ensure that there is a session appropriate to everybody who's going, and how is that communicated through the marketing?
That is a very good question. You've reminded me of something I needed to mention, so that's good. We are asking all speakers to sort of try and make it clear what level their talk is pitched at, and we're still doing that at the minute, and people are sort of supplying us with that information. What we're then doing is just going through the schedule just to make sure that we are really well covered, and that people have got options for all times of the day. So we might have to potentially tweak some of the timings, but we should be well covered. So as well as making sure there's a key takeaway from every session, we've also got some key themes that you'll be able to follow around. So things like women's health, for instance, or older people. And then there's also the level of the talk as well, and that's something we're collecting that information. So that's again something that was raised in feedback last year and by the advisory board that we're acting on and trying to sort of implement.
Brilliant. Lindsay Pence, that's exactly what I was going to ask. Thanks, Gary. Fantastic, great. Fiona, dry needling. Yay or nay, or depends?
Oh, this is a really interesting. It's a really interesting question to ask me, because I think I've had a very positive experience using Chinese medical acupuncture in Taiwan from like a traditional Chinese medical practitioner. I've never had acupuncture or dry needling in the UK, and I'm aware of all of the controversies around durations of like training and things. The only person I've ever taken dry needling treatment from is probably trained for the entirety of their adult life to do it, and it's like an ongoing thing. You never stop being a student if you're a Chinese medical practitioner out in Taiwan. So I don't know. I think it's as a therapy, it's very effective at treating pain. I've had first-hand experience of that, but I don't know whether it's necessary in the settings that we provide it as therapy practitioners. It often depends on the client, doesn't it? So is that a broad enough answer?
Fantastic answer. Yeah, I just like hearing your
Sit
mind
on the
work.
fence.
That's fine. You mentioned training. That's something, Gary, you've got quite passionate about, aren't you? And you think maybe that's the crux of the problem when we do. We're kind of introducing here, it's a segue into the whole Ellen White story. That showed up quite nicely. For those of you who aren't aware of that, then we got top goal scoring England player who revealed in August or something that her lung was punctured when she went. Well, she had actually Man United, isn't it? Man United brought in an external physio. I'm not sure if they've actually revealed what training that person did, but yeah, she ended up with her lung punctured, and that led to all sorts of problems, and she's retired early. So it's cast a shadow over acupuncture and dry needling, which obviously people have jumped on, very polarized. But your point, which you make, Gary, is about training, isn't it?
Yeah, so I'll just clarify that the CSP, I believe, have issued a statement to say that it wasn't a CSP or the AACP, which is the Acupuncture Association for Chartered Physios. It wasn't one of their members. So, we speculate of who it was or what treatment was provided. But, what I would say, and I say this regularly to people who ring me up and say, oh, I've seen an online course. What do you think? Will that satisfy CPD requirements? And I say, what you have to look at is, excuse me, imagine the worst case scenario that you are applying a needle to your client and they suffer a punctured lung. Imagine yourself in the dock in a court of law in front of the legal profession, asking you to justify your treatment modality, your clinical reasoning, your justification, your choice of the length of needle, the direction of application of that needle. If you've only done an online course where you can see what we're looking at now, in effect, everybody who's watching this podcast, we can see a 5-inch square of somebody leading this podcast. Now, if you're happy to go and study like that, I'm not going to stop you, but what I would say is, would you go and have a treatment from a person who'd done that online training course? And there are, you don't have to look very far on the internet to find online courses that are, in duration less than 2 days, certificates of attendance issued to people who are not English speakers who have attended and didn't really comprehend what was going on for most of the day, getting a certificate of attendance or completion, people who have to leave early on Sunday because the only train that they can get leaves at 2:00, so they miss 25% potentially of the training, and but they're getting this certificate of attendance or completion. So my general advice for people who are looking for this type of training is to speak to your professional association, see if they've got any recommendations of appropriately qualified training providers. Have a look at the content of the course. I've got a comprehensive content which I'm willing to share with people of what a course should look like. But generally speaking, they're saying that you have to be a level 4 massage therapist, sports massage therapist practitioner with 2 years clinical experience. Yet I know there are training providers out there who will accept somebody who's only just trained at level 3, which I think is, not ethical. But would you go and see a person who'd done a non-comprehensive training program? And I certainly wouldn't. I like having needles, applied to me because I find it very, very beneficial. And my practitioner has been doing that for several years and is appropriately trained by a company that no longer exists but was part of the AACP. So then you've got to look at the qualification accreditation. If it's accredited by a professional association, what relevance does that have? Because I could accredit a course, but I'm not occupationally competent at administering needling application. So my accreditation would mean nothing. So when you're looking at a course, make sure it has pre-course reading, it has a minimum training. And I'm not going to say what that training should be. That's down to the training providers. But I would be looking to follow something like Dr. Chris Norris's content, over 5 or 6 days rather than a 2-day course. I'd be looking at something that has case studies. I'd be looking at something that has an assessment of occupational competency by somebody in the same room who's appropriately trained. to degree level, not necessarily somebody who's done a weekend course and then starts to deliver their own courses. So there are lots and lots of things to consider, but it all comes back to, would you go and see the person who's done a short course? And if you wouldn't go and see that person, don't book onto it.
There we go. Kind of makes sense when you think about it. And that's probably the biggest thing that should come out of this debate that's been going on. Rather than trying to go down the route of defending acupuncture and defending dry needling, there's no quality evidence for it, full stop. Okay, I think that's worth saying, because there isn't. And the evidence that does support it is normally from China or Russia, where guess what? Every single study they do on it shows a positive result. That doesn't happen. Okay, there's always bad results if you're doing research properly, because it just balances itself out depending. So you can't defend it saying there's evidence for it, but that doesn't mean, absence of evidence doesn't mean that it doesn't work. So it's still worth having the debate. And anecdotal evidence is an important part of evidence as well. Gary said it works for him. Fiona said she has some good I've had it from my sister-in-law, and it felt great for a day. Okay, now if that's all you want to get through for the day, then that's wonderful. But I got frustrated because I was back to square one within a few days. So I was like, okay, I'm not going to pay for more of that. But that was just my personal experience. So I think it's not worth people out there arguing and getting all hot-headed about whether there's evidence or not, because there's not. Okay, there's not at the moment. But that's not the important point. The most important point is, if you're going to do it, go with something which is competent training wise, and they're going to make it safe, and they're going to, I think that's what basically you're saying, isn't it, Gary?
Matt, it's worth saying that in that article that you've linked there, Ellen mentions during acupuncture. We don't know whether that's the journalist's license to say acupuncture, but generally we shouldn't be using the term acupuncture because we haven't got a degree in it. We should be using the terms dry needling or medical acupuncture. They're the two sort of definitive streams. Now, I'm not an expert, I'm not occupationally competent, but my understanding is that dry needling is based on sort of trigger point applications, where medical acupuncture is based on the use of meridians, which moves more towards the Eastern philosophies. So we don't know whether she, as you mentioned at the start, whether she had an appropriate treatment by a regulated professional or a non-regulated professional. There's a lot of hypothesis and guesswork in that. So, to me, it's it is important that us as therapists remain professional, and we view our CPD as professionals, and we do our due diligence basically to make sure we're paying for something that assesses us to be occupationally competent. And insurance companies, and I'll use an example, in Ireland, you're not going to get an insurance policy for dry needling for under several €100 because of the prevalence of claims that are happening over there. Now, to me, that's the underwriters getting a bit twitchy and saying, you're not trained well enough. And if you could stand up in a court of law and justify your 2 days training gives you that right, then I honestly couldn't.
I don't think anyone should. That kind of helps end the argument as well, doesn't it? Who's going to defend that? But Chris Norris is at Therapy Expo. I'm sure
he is. Yeah,
I can't remember what day it is, but he's there.
Yeah, day one in theatre. Yeah, he's got 2 sessions, one on core stability and another on clinical reasoning.
Fantastic. So, and I'm pretty sure there's a couple of other expert speakers there talking about dry needling. So it's all there for you to listen to. There was this same debate, just because I think it was today or yesterday. It's the same kind of thing that goes round and round about somebody was asking in one of the groups about pregnancy in first trimester. It was like, help, my client wants a massage today and she's just been tested positive. Fiona, that's kind of, I don't want to label you just down to women's bits, but that's kind of something you specialize in with the women in sports therapy. But can we put to bed this idea that women in the first trimester shouldn't have massage or not?
You know what? That's a really good question that I'm hoping we can put to Jenny Burrell. She comes on our podcast, the WIST podcast. I think, is she episode 2 maybe? So that should be going out. We have yet to record it, but it should be released around October, I think. The end of October, the last Monday in October. And really
Jenny's going to be speaking after you as well. She's on after you on Wednesday in the STA Theatre.
I can't wait to
meet you personally. Don't sit on the fence, Fiona. Come on. You're a doctor. Give me the answer. Yes
I
or no?
think I like, obviously none of my opinion could be based on evidence because I simply haven't read on this area at all. I've never had a client come in who's been in their first trimester or even pregnant, and there's definitely wariness. I think that my feeling, like, I mean, my action would be to literally go and look at research if there's any systematic literature reviews, any publications by health authority or NICE guidelines. The first trimester, from what I understand, is a bit of a delicate one, so even if it's not the actual treatment itself, but maybe a secondary factor like stress from it, the experience of trying, maybe especially a first treatment, I think there's so many variables that could influence it, that it may be something that I would want a GP to clear. Well, I would definitely want a GP to clear, but like, I haven't had training in prenatal massage, so I wouldn't do it unless I'd had training. Personally, that's my opinion. I want a GP to approve.
There you go.
So
You're very good. I love the way how many times you said my opinion. It's very good. That's how it should always be. I mean, the evidence, as far as I know, and because I just like, as soon as I see an argument on social media, I'm there just looking and trying to work out. As far as I know, there's no evidence, because the common idea is that the biggest thing is it's going to cause a miscarriage because of the increase in blood flow. Take away the blood flow, because we know that massage doesn't affect blood flow, because it can't. Because if you want to increase your blood flow, you need to increase metabolism. So you can't calm someone down and speed up someone's metabolism at the same time. It doesn't work. So if you take out that blood flow myth, then, and there's also no evidence that increased blood flow increases the chance of miscarriage. But as I was reading and trying to challenge my biases, I was hearing something, Gary, that I wanted to check with you. Apparently, some insurance companies will still not insure you if you are giving a massage to somebody in the first trimester, and that's where some of the worries come from. Have you come across that at all?
Yeah, I think it's, again, underwriters being twitchy, but if you I'm pretty sure that Anna Maria Mazzieri has done some work on this, either as the Massage Collective or Massage Matters. I'm sure they've covered this, but in a lot of courses, contraindications are taught so that it sort of makes the provision of massage easier. So if you don't, you're not allowed to do cancer patients, you're not allowed to do first trimester pregnant ladies. They're cutting out any sort of return to them as a training provider. So I think they're being extremely cautious. I'm not aware of any evidence, but I'm not an expert of treating ladies who are pregnant.
My wife is pregnant at the minute, and she wanted to get a massage in the first trimester, and she was advised, I think, by the midwife not to. Didn't give a reasoning for it, but today we had a debate where they were saying that you're meant to sleep on your side rather than on your back, and if you don't do that, there can be an issue with blood flow or something because of the way the uterus is shifted or something, because of, I can't remember the exact thing, but they were like, don't get straight up if you've been lying on your back, go on your side first, and all sorts of things like that.
There's vascular related things that may not be local to where the treatment's being delivered, and I think that's probably where the crux of the issue is clarity on what are we talking about when we're talking about blood flow, because the whole body has a very complex circulatory system, and that there are, like, in the abdomen, there's major structures there that provide blood to the baby, and compression, and even just turning over and positioning when lying is like a massive factor that could influence.
I like to think, I've got faith in the human body, which is pretty much designed to survive, that if a woman was lying on her side, rather than think, no, I'm comfortable, I'm going to stay here and something terrible happens, she'd turn over.
You'd hope so.
I don't know there's many cases of women who forgot to turn over and something terrible happened, because
I don't know, I've had a few dead arms overnight.
But you don't wake up after 8 hours and necrosis is set, and it's like you're going to adjust your body eventually, you move. That's why, I don't know.
Yeah,
but it's tricky.
I think
the other thing is, go on there, Gary.
I was going to say, if we look at the human body, it's quite a robust machine, isn't it? My ex-wife, who was a fitness instructor, taught classes, ran long distances whilst pregnant. You know, so I suppose if I had a gut feeling, it would be along the lines of, just because you're pregnant is not an illness, and if you carry on doing the things that you're doing, I don't foresee a problem. But you know, if you become pregnant and then decide to run a marathon, that might be a different matter if you're not already doing it. In the same line, if you don't have a regular massage and you fall pregnant and then you want a regular massage to ease the lower back pain or the stress related aspects of it, then that might not be a good idea unless you're used to having them. So it's continue what you're doing. And you see more and more, you know, I'm getting members who are telling me that, oh yeah, I'm going on maternity leave at the end of October, baby's due in December, but I've worked all the way through and I hope to get back to work in March. So there's a lot of people who are, you know, carrying on as normal and not treating it as an illness. It's just a condition.
Yeah. Serena Williams won the Australian Open when she was 6 months pregnant, didn't she? A few years back.
I mean, I've seen someone's waters break during a step class, and one of the instructors where gym I worked at, and literally from that step class, she went to have a baby. She was working up to the time the waters broke. It was like, now this might be n = 1, but I just worry about, like, congratulations, by the way, Liam.
Oh, thank you very much.
Well, well done. You didn't play much for part, but yeah, you are the heart as well.
Yeah,
but,
very brave.
Did she, out of interest, did she take that advice and now will not have a massage even though she feels that it might be nice, or is she getting a second opinion? Or
so she's out of the first trimester and she's getting a massage now in the second one. But yeah, she didn't have one in the first trimester.
Because that's what worries me a little bit as well, is that might be exactly what we know can affect health is stress and tension, and for many women it can be an extreme time of tension and stress, especially the other half's not chipping in much. So maybe, and we know massage can bring down stress and anxiety. It's the one thing which has been proven. So maybe that massage could have a fantastic effect and be beneficial in terms of health, following the evidence. But I suppose it's all individual, isn't it? All individual.
Matt, if we look, sorry, Fiona, go ahead.
I was only going to say, just maybe, I mean, like liability wise, there are so many factors that you can't control. And unfortunately, I think, you know, we talk about miscarriage, but like, you know, very early stage miscarriage, a lot of people might consider that to be a low trauma type thing to happen, you know. But there are so many variables that we can't control as therapists. And, you know, it is quite common, like it's more common than people talk about. It's a very personal thing, and I think that maybe there's a possibility, if there's a possibility that could come back and be blamed on a treatment of some sorts, which is perceived to be sometimes painful. You know, sports massage is notoriously kind of renowned for being enabling pain management strategies by increasing other sensory input, and you know, it risks could be managed maybe. Like,
I think that reinforces, Fiona, that point reinforces the insurance underwriters getting twitchy about it.
Yeah.
You know, they don't want to be put in the position where they're going to have a claim put against them because of the decision to either treat or not treat by the sometimes relatively inexperienced massage therapist.
Yeah.
It's an interesting one. There's a couple of comments here from people who've joined us live. Thank you. Let's just bring a couple of these up. Wow, the time's going very quickly tonight. Catherine Ryan has said, I've massaged 2 friends who were 2 weeks pregnant. They didn't know they were pregnant, and neither did I. They told, it might be weird if you knew they were pregnant and they didn't. I don't know how that works. But anyway, they told me a few days after. It would be hard to know or check if they don't know. Yeah, true.
Yeah,
Okay.
that's true.
And then Claire Hunter says, also, low leg areas can potentially be an issue to massage on pregnant ladies, which relates to full knowledge of acupuncture and channels of the body. Could you expand on channels? No, we haven't got time. What do you mean by channels? That's okay. Another day, we'll save that for.
Well,
yeah.
Matt, that's more of a. I think that's more of a reference to if I have a treatment, for example, I might have a needle applied in my bladder channel or bladder 23.
Right.
Or I've just made that up. It may not exist, but Claire, who applies acupuncture to me, will correct me on that if I'm wrong.
Well, there we go. Okay. Interesting, isn't it? we haven't got time to get into the whole channel thing and meridians and stuff, but it's interesting. But again, if you've had your training, you know what to look out for. There we go. Marco Mendonça has said the issue could be that even related or not, the person having the miscarriage will think it was a massage treatment involved on the situation. Unfortunately, it's true.
Yeah,
you know, it's true. But that's about the conversation, isn't it? Having it with
until we've
that
got more
person.
evidence, like
Yeah.
to show that it's not related, it's very hard to defend it. So,
And I think
that way
that's
around, should it?
what's that?
Sorry,
It shouldn't be that you have to defend it until the evidence is there. That's like saying you're guilty till innocent.
Yeah.
But it's anyway.
But I think that, you know, again, I'll go back to my point about the insurance companies getting twitchy. You know, we live in such a litigious society now where there's a solicitor for every blame, you know, whether you've had a road accident, you know, if you have a miscarriage and you say, well, the only thing I did differently was have a massage, you know, 99 times out of 100, that solicitor will say, well, massage caused it. We'll pursue this claim for you. So, hi, Marco. Hope you're well anyway.
Anyway, yeah, lots of food for thought. That's great. Interesting. Okay, well, look, it's already 8:55. We got, I didn't think you guys were going to be hanging around for the full hour. Must be about the great content and conversation between us. I just want to quickly remind people, I'm going to bring this up. Let's get rid of Ellen for the moment. Thanks for providing the conversation, Ellen. I hope you will. We'll get rid of that. Let's just bring up, I'm going to put this on full screen so people can see, because we have been talking about therapy. Oh, no, not that. We're going to just briefly let you know, so it's on video, what's happening at Therapy Expo and as with regards to the STA Theatre. Let me just put it on the right order before I bring it up. So as you know, it's over 2 days. Let's put this up now. So obviously there's lots more going on. It's not all just about the STA, but in the STA Theatre, as for last year, on the Wednesday, we will be opening up with Deborah Thurlow-Rowley, the other half of the Women in Sports Therapy podcast, also known as WIST, with our Dr. Fiona Higgs here as well. It's going to be a roundtable debate with a couple of guests, including Anna-Marie Mazzieri. It's going to be a really lovely way to start the day, and I think it'll set the scene for the rest of the 2 days as well. That's going to be followed. We've already mentioned Jenny Burrell, are talking about beyond pregnancy massage. So all the things we're talking about, we've covered in the STA Theatre at Therapy Expo. This is on the 23rd of November. If you listen to the podcast, I'm reading it out for you. If you're watching the video, it's all here for you. We have got James Earls, who's also been on the podcast, talking about understanding the human foot, which has been some speaker which has some heavy demand for. Male pelvic health, red flags, with Bill Taylor, who's been a guest. So we are not forgetting about the men. We would have had a morning of looking at pregnancy and women's sports therapy, but we've got male pelvic health at 1:45. Claire Minchell with critical differences between strength and power. We'll be doing that at 3:15. And then Never Too Old to Lift with Chris Tiley, which was hugely popular last year. So even on day one, we're pretty much covering birth to death. Okay, that's the way it's working. It wasn't my intention, but that's the way it's kind of worked out. And maybe that was done subconsciously, but we're covering everything that happens between birth and death. And that's just day one. On day two, just so we got a nice reference for this, for people who do want to go to YouTube and watch the video. Let me just bring this up. Thursday. Right, so Thursday we start at 9 o'clock with Paul Coker, previously of Rock Tape. And now at Movewell Clinic in Cornwall. He's going to be coming in and co-presenting with Anna-Marie Mazzieri. They'll be doing massage and manual therapy and modern view. So a lovely way to start off Thursday, talking about, okay, we want to make sure that what we're doing is current, as evidence informed as possible. So where are we in 2022? That'll be followed with Liz Bailey talking about the dancer's foot, dance specific. That's going to be amazing. I'm so glad we got Liz Bailey on the in the STA Theatre. At 11:30, we got Understanding Your Client's Behavior Change with Dr. Gary Mendoza. One of my favorite episodes of the podcast from last year. I think it's so important understanding where your client is to make a behavioral change, whether it's regarding strength or diet, whatever it is. Understanding that with motivational interviewing is so important. Otherwise, you're just giving them instructions, recommendations, which they may go home and never do. So he'll be on. Return to Running Postnatal with Emma Brockwell, again, guest on the podcast. She will be with us at 2 o'clock, so specific for women returning to running after pregnancy. It's going to be a great 40 minutes as well. And then we finish off with sports therapy and mental health with James Chapman, mental health first aider from All About the Mind, which again has some great feedback about looking after yourself as a therapist with regards to mental health, and also having an idea of what your clients could potentially be going through and looking out for red flags or where you could direct them on, rather than just perpetuating their cycle of discontent and misdiagnosis, playing a bigger part in that health provision kind of cycle of different people. So I mean, looking through that myself, I know I'm biased, but it looks like absolutely, I don't want to swear, but a frigging great, is frigging a swear word? I don't know, might have edit that out. Fantastic 2 days. And that's just the STA Theatre. I mean, I hope you do look outside of that and consider the other speakers, but you know, you wouldn't go far wrong just sticking with us for the 2 days, but it's up to you. It's your choice. It's pretty exciting to get that, don't you think, Fiona? Gary, I'll come to you, Liam, at the end, because I know there's other speakers, but pretty proud of what we put together, don't they?
Lineup looks amazing.
Don't it just? I think so. I'm really excited.
Yeah.
But there is a lot more. I mean, you've got that. I mean, that is worth £200 alone. But you've got a lot more of other speakers who will be addressing the. How many other stages are there? How many other theatres are there?
There are another 6 on top of them.
Crazy.
So there's, I mean, we've got more choice than ever before, and we're packing in more speakers, especially because we're doing different session formats as well, like panels and other things. So I think we've got about 30-40% more speakers than last year.
Oh gosh, it's going to be so good.
So there's loads going on. There really is sort of something for everyone and something every time of day.
And and if it's anything like last year, fantastic areas to get refreshments, sit down, converse, chat, network, loads of stands, loads of interesting things to do. Great couple of days out. So it sounds like I should go and work in your marketing team, but I don't mean it to come across like that. I just get really excited by it because I think it's really good. Anyway, well, look, it's 9 o'clock. That went by so quickly. How are we going to finish
Matt,
this?
can I just finish with a few things, please?
Yes, of course.
Just remind STA members that tomorrow evening, Wednesday the 7th at, I believe, 7:30, Scott and I will be holding our monthly coffee evening chat where we can discuss with new members, more experienced therapists, anything they want to know about the industry, whether that be marketing, business, whether that be case studies, etc. So you can join us by clicking the link in the STA members Facebook group. Fiona and I spoke earlier, and I said I was having a meeting with an industry colleague who Fiona knows. I'm not going to say the name at this point, but the feedback that I received about what we're doing at the STA, to the wider industry, there's a lot of respect for the content that we're putting out. There was special mention of the really important topics that Fiona and Debs have been covering, and how the Women in Sports Therapy podcast has become a really informative place for women's health related and women in sports therapy related issues. But also, I want to say on record, Matt, that this web chat from the initial ideas that we had has grown into something that's it's like a juggernaut now. We get people asking to come on. So, for the record, I'm extremely proud of the whole of the STA team for the content they're putting out there, for the effort they're putting in, so that's Scott, Debs, Jake, Fiona and Matt. Thank you very much for your efforts. It's an honour to be involved with you all.
Led from the top, Gary. That's what we do. We'd be nothing without our leader. So thank you.
Absolutely.
Isn't it just?
Yeah. Thanks for the opportunity, Gary.
Well, you're welcome. What I'd like to say to people who've been asking me this question for the past few weeks is, we are going to be discussing, and I'm going to be having a chat with Matt about this in the coming weeks. We are going to be discussing in one of the next upcoming STA updates the whole confusion around qualifications, one-day diplomas, their worth in the industry, about course levels, about occupational competencies. So I wanted to do it sooner than we have done, but I'm doing so much research in the background and collating all of the information. But yes, we are still on it.
Great. Yeah. And as always, we'll keep you updated with all of these things in the pipeline. There is so much. It's lovely to have people, and we do take all your emails seriously. If you are somebody who's saying, oh, we want to see this and can we come on the show and stuff, It's just, there's so much content out there we'd love to share with you all. So, Liam, thanks so much for joining us.
No, thank you very much for having me. And brilliant to work with the STA again this year on the theatre, and brilliant to be on the podcast again as well. So thanks for having me.
We're really excited. I mean, it's again, there's a lot of conventions around and stuff, but Therapy Expo, just by having the advisory panel and you obviously listening so much to recommendations and looking around and giving the people what they actually want, it fills me with confidence. It's good. So thank you for doing all of that.
Cheers.
Right then, gang. So that's it. That was really nice. So that's gonna be the first of every month. Have your say. So if you've listened to the podcast and you like the idea of having your say and asking some questions and commenting on something and having a chance to talk about industry-related topics, then just put the first Tuesday of the month in your diary. Go and do it now. Just say, 8 o'clock YouTube, and you're welcome to come along. And we'll always have people here who can hopefully answer your questions, or if not, we'll direct you to the right person. Next week we will start off bringing as guests some of the people who are going to be appearing at Therapy Expo, to give you a little teaser of what they'll be talking about, what they've been up to, and what they're looking forward to. So it's kind of full steam ahead now until we get to November 23rd and 24th. So looking forward to that. I'm not sure who is going to be here next week. I know the week after we've got Anna Maria and Matt Sierra and Paul Coker talking about how they're going to be involved in Therapy Expo. But yeah, if you want to find out who's going to be on, then just make sure that you are following UK_STA on Twitter or Instagram for updates. And as always, if you're ever interested in joining the STA for maybe that fantastic 20% discount, which will be changed, then just go along to www.thesta.co.uk, and all the information you can need is there. It's shockingly low. Because we're just all about raising standards, and part of that is not making money out of you. It's about just making enough money to provide you with a great service. So all the information you can need about joining us is there. Bueno, that's it. We're finished. Thanks again, Liam, Gary,
thank you very much.
Dr. Fiona Higgs. And we'll hopefully see some of you live next Tuesday at 8 o'clock on the Sports Therapy Association YouTube channel.
You're listening to the Sports Therapy Association podcast, putting evidence back into soft tissue therapy.